I'm eating nothing but ribeyes and my arthritis is gone. That's how my recent patient Mike, a tech executive and a former D1 athlete, started our consultation. The stack of Reddit threads and Joe Rogan timestamps he brought told me exactly where this was going. Another carnivore diet case. I've been shocked by what I've found in the carnivore diet. But here's what stopped me in my tracks. Mike's inflammatory markers plummeted, and his joint pain really was almost gone. He was back to crushing CrossFit workouts after years of debilitating symptoms. As a Stanford-trained physician who focuses on longevity medicine, I've learned to look beyond the hype and the knee-jerk skepticism. Because while my medical training taught me to question extreme dietary approaches, my clinical experience has shown me something fascinating. We're seeing outcomes that our traditional medical frameworks struggle to explain. The carnivore diet sits at this peculiar intersection of clinical medicine and patient-driven experimentation. In my longevity clinic, I'm watching a wave of high performers, mainly tech and finance professionals, diving into what might be the most controversial dietary approach in modern medicine. Some report transformative results, others quietly struggle. The question isn't whether it works or doesn't. That's far too simple. The real question is what's actually happening at a physiological level, and why does it seem to work dramatically well for some while potentially harming others? In today's episode, we're cutting through the noise. No Reddit anecdotes, no influencer-driven hype, just clinical observations, current research, and the complex reality of what I'm seeing in the practice. We'll explore why traditional anti-inflammatory protocols sometimes fail while carnivore succeeds, the metabolic mechanism that might explain these counterintuitive results, and the crucial factors that could predict success or failure. And finally, we're going to touch on the long-term health considerations we can't ignore. I'll share some key labs that I look at, the patterns I'm noticing, and when I tell patients to reconsider this approach. What you're about to learn will challenge some of our basic assumptions about nutrition and inflammation. And as a doctor, that both excites me and concerns me. Let's start with a fascinating piece of medical history that most people don't know about. In the 1880s at Harvard Medical School, Dr. James Salisbury, yes, that Salisbury, was pioneering something revolutionary, using all meat diets to treat Civil War veterans suffering from chronic digestive issues and what we now recognize as PTSD. His success rates were remarkable enough to earn a place in medical textbooks, then promptly forgotten for over a century. But Salisbury wasn't the only one onto the carnivore diet. For generations, certain traditional cultures have thrived on diets remarkably high in animal products. Take the Inuit, for example. Some Inuit groups traditionally consumed diets where up to 85% of their calories came from animal fat and protein, primarily from marine mammals. Early observations of these populations showed a surprisingly low incidence of heart disease, although it's important to acknowledge that this is a complex issue, influenced by numerous factors beyond just diet, including genetics and lifestyle and environment. Nevertheless, their traditional diet provides a compelling real-world example of high-fat, high-protein dietary pattern that has sustained populations for centuries. Fast forward to 2018, a pivotal moment that would transform this forgotten medical footnote into a global phenomenon. Jordan Peterson appears on Joe Rogan's podcast, describing how an all-meat diet apparently resolved his depression and his daughter Michaela's severe autoimmune conditions. This episode goes viral, and suddenly my medical colleagues and I are fielding questions about a dietary approach that challenges everything in our nutrition textbooks. But here's what made this moment different from every previous dietary trend, a perfect storm of three factors. First, we're seeing unprecedented frustration with conventional medicine's approach to chronic conditions. Patients are tired of being told their labs are normal while they're still obviously suffering. They're pushing back against the one-size-fits-all solutions that dominate standard practice. Second, and this is crucial, the democratization of health data. With continuous glucose monitors and at-home lab testing becoming widely available, patients aren't just experimenting, they're collecting data. They're tracking inflammatory markers, lipid panels, and hormone levels with a precision that was unimaginable just a few years ago. And third, social media has created what I call citizen scientists. During the pandemic, while most people were perfecting their sourdough starter, a different experiment was unfolding amongst biohackers. Lots of tech bros and many others, armed with data and an optimization mindset, started publicly documenting their carnivore experiments. Names like Paul Saladino and Sean Baker became reference points in medical discussions, for better or worse. What makes the carnivore diet particularly interesting from a medical perspective isn't just the anecdotal reports. It's the underlying theoretical framework that proponents have built. This framework, often referred to as the evolutionary mismatch hypothesis, attempts to explain the diet's purported benefits by looking at human physiology through the lens of our ancestral past. It rests on these three intriguing, although controversial pillars. So first, there's the argument called the plant defense paradox. Conventional nutritional wisdom emphasizes the benefits of plant-based foods. However, this perspective often overlooks a crucial evolutionary reality. Plants don't want to be eaten. Over millennia, they've evolved sophisticated chemical defense systems to deter predators. These include compounds like oxalates, lectins, and phytates. For most people, these compounds are harmless at the typical dietary levels, and some may even offer health benefits through hormetic effects, essentially triggering mild stress responses that upregulate our body's defenses. However, for individuals with certain sensitivities or compromised immune systems, these plant defense compounds might contribute to inflammation and other health issues. The argument here is that by eliminating these compounds entirely, the carnivore diet may remove a source of chronic low-grade immune system activation in susceptible individuals. This is particularly relevant for those with autoimmune conditions where the immune system is already in a heightened state of reactivity. Then we have the nutritional completeness argument. Here's a fact that often surprises even those in medicine. Animal products contain every essential nutrient humans need for survival and often in forms that are more bioavailable than those in plants. For instance, heme iron from meat is absorbed far more efficiently than non-heme iron from plant sources. And when I review nutrient tracking data from my carnivore patients and listeners, I'm often struck by how their micronutrient profiles, vitamins, minerals, and many other essential compounds frequently surpass those who are following vegetarian or more plant-focused diets. This isn't to say that a plant-based diet can't be nutritional complete. It really can, but it just requires careful planning. The carnivore diet's proponents argue that obtaining optimal nutrition is simply more effortless when consuming animal-only products. It's worth noting, though, that this comes with important caveats regarding long-term health implications, which we'll delve into later. Third, we have the metabolic shift hypothesis, or sometimes called the metabolic operating system overhaul. Think of your metabolism like a sophisticated hybrid car capable of running on either gasoline or electricity. Our bodies have a similar metabolic flexibility. Ideally, we can either utilize glucose primarily from carbohydrates or ketones and fatty acids from fats for fuel. The standard American diet, often high in processed carbohydrates, keeps us primarily in glucose burning mode. That's why it's so hard to get rid of that excess storage fat that everybody complains about. The carnivore diet, by drastically eliminating carbohydrates, forces a complete and sustained shift to the alternative metabolic pathway of ketosis. It's akin to switching your body's primary operating system, a profound change that can have significant and sometimes unpredictable effects. This metabolic shift impacts everything from hormone signaling to cellular energy production, and supporters argue that it's key to many of the reported benefits of the carnivore diet. Is this evolutionary mismatch framework a perfect explanation? Far from it. As a physician, I have serious concerns about the long-term effects of the carnivore diet, particularly regarding cardiovascular health and the gut microbiome, which we'll explore in detail. However, I'm not dismissing this framework out of hand, because in reality, we're seeing a lot of benefits for people who have tried and failed conventional treatments and seeing now remarkable improvements on the carnivore diet. So this compels us to investigate further. What exactly is happening inside a person's body on the molecular and physiological level when they start a carnivore diet? Let's dive into the biochemistry. I described a hybrid car model earlier. Your metabolism is far more sophisticated than a simple on or off switch. While glucose is the body's preferred fuel, we possess a remarkable degree of metabolic flexibility, that ability to adapt and utilize different energy sources based on availability. So when carbohydrates are scarce, our bodies can switch to using ketones and fatty acids for fuel. That's what we know as ketosis. That's the hybrid car switching between the gasoline to the electric power. When you start a carnivore diet, you are essentially restricting yourself of carbohydrates. And during this time, the body orchestrates a complex metabolic shift. The liver's glycogen stores, which typically hold around 100 to 120 grams of glucose in most adults, are depleted first. As these reserves dwindle, a cascade of hormonal changes initiates. First, we have insulin levels, which decrease. Then we have the rise of glucagon levels, and the liver begins to ramp up ketone production, primarily beta hydroxybutyrate, or BHB. This is like watching a finely tuned biochemical relay race, which each hormonal and enzymatic change triggering the next. To really bring this clear, let's go week by week. So in week 1, we have the metabolic revolution. Going back to that car analogy, imagine that you have a hybrid car that's been running almost exclusively on gasoline its entire life. Now, the carnivore diet is essentially saying we're switching to all electric. While the car has an electric engine, it hasn't been used much. It's like having muscles that have been atrophied from disuse. They need time to regain their strength. So here's what happens in those first crucial days of metabolic adaptation. In days 1, 2, 3, you have the great glucose depletion. Your body, which is accustomed to readily available glucose, will rapidly deplete its remaining glycogen stores. This is like a cell phone battery draining quickly as it relies on its remaining charge. Your brain, which typically relies heavily on glucose for fuel, consuming roughly 120 grams of glucose daily, begins to sense the dwindling supply. This is the phase where many people report experiencing what's commonly called carb withdrawal or the keto flu. Symptoms include headaches, irritability, fatigue, and difficulty concentrating. Some people describe it as feeling like their brains are running on dial-up internet. Then on days 4 through 7, you get the electrolyte shift and mitochondrial adaptation. As your glycogen stores become depleted, your body undergoes significant fluid and electrolyte shifts. Glycogen is stored with water. So as it's broken down, water is released and excreted, leading to a loss of electrolytes, particularly sodium, potassium, and magnesium. This rapid fluid and electrolyte loss contributes to those keto flu symptoms. Think of this phase as your body's operating system undergoing a major software update. It takes overnight for your computer to do this update, and it takes your body a little while to get updated as well. Essential processes are being reconfigured. Your mitochondria, the cellular powerhouses, are adapting to the new fuel source. They begin to upregulate enzymes necessary for beta oxidation, the process of breaking down fatty acids for energy, while downregulating enzymes involved in glycolysis, the process of breaking down glucose. Your liver plays a starring role in this metabolic shift. It significantly increases the production of enzymes like carnitine palmitoyltransferase 1, CPT1, a key enzyme for transporting fatty acids into the mitochondria for beta oxidation. This hepatic adaptation is crucial for efficient ketone production. This process explains why some patients hit a metabolic wall. Their cellular machinery is undergoing a profound reconfiguration. I cannot overstate the importance of electrolyte management during this phase, especially sodium. I've seen highly intelligent people reduced to a state of mental fog simply due to electrolyte imbalances. So when insulin levels drop on a low carbohydrate diet, the kidneys excrete more sodium. And to compensate, it's often necessary to increase your electrolyte intake, including sodium, by about 2 to 3 times the usual amount or more. So the typical recommendation is to aim for about 5 to 7 grams of sodium per day during this adaptation phase. Now let's move into week 2, which is the metabolic divergence phase. This is where someone starting the carnivore diet will experience a divergence in their experience, highlighting the complexities of individual metabolic adaptation. Some people have a huge surge in their energy and their mental clarity, and they sail through this phase with this unlimited energy. But then others will hit this metabolic wall where they're just so tired and just can't live their regular life. I thought this was funny because this is a week 2 journal of somebody who started a carnivore diet. On day 8, they said something like, I'm moving through molasses. And then by day 10, it's like, I had to cancel all my meetings. I can barely think. Day 12, something shifted, energy starting to surge. By day 14, 2 weeks into the carnivore diet, this person expressed that they had the best workout in years. Their joint pain went down to 60%. So what explains this dramatic shift? During this phase, the body is completing the transition to efficient fat utilization. Ketone levels are rising, and the brain is gradually adapting to using ketones as their primary fuel source. This process can take time, and the initial lag in energy production can lead to that metabolic wall that we described. It's just like that car undergoing a complex engine conversion. There will inevitably be a period where it's out of commission while the new engine is being installed. Importantly, most people will adapt by day 14 to a keto diet, whether it's from a carnivore diet or from just simply restricting carbohydrates some other way. Now I want to talk about the improvement in inflammation that so many people experience on the carnivore diet. This happens in weeks 3 to 4. This is a truly paradoxical observation that challenges conventional medical understanding of diet and inflammation. So traditional nutritional guidelines often associate high meat consumption with increased inflammation. However, a lot of people undergoing the carnivore diet often have a significant reduction in their inflammatory markers. Let's take somebody with the atopic triad. So atopic triad is just a fancy name for somebody who has asthma, eczema, and allergies. Often comes together. They're all conditions associated with chronic inflammation. So in this case, pre-carnivore, CRP levels, which measure inflammation, were up to 22.4 milligrams per liter. Normal is under 3. ESR was also high. And in this case, this person had active eczema flares on their eyelids and their arms. But after 4 weeks, we see a normalization of CRP levels to 2.1. ESR also went down from 48 to 15, and a total resolution of eczema flares occurred. These dramatic reductions in CRP and ESR are not isolated findings. While individual results will vary, these improvements are consistent with reports from other clinicians and people who have tried the carnivore or other kinds of ketogenic diets. There are several mechanisms that might be contributing to this anti-inflammatory effect. First, you have reduced dietary antigens. Eliminating plant-based foods removes potential dietary antigens that could trigger immune responses in susceptible individuals. Remember, I mentioned plants have a lot of factors that are fighting off being eaten, and your immune system has to react to that. This is particularly relevant in cases where people have food sensitivities or allergies or some other kind of autoimmune disease. Second, we have the suppression of the NLRP3 inflammasome. The ketone bodies, particularly BHB, have been shown to directly inhibit the NLRP3 inflammasome, which is a key component of the innate immune system that drives production of pro-inflammatory cytokines like IL-1 beta and IL-18. Third, we have the modulation of intestinal permeability. So some evidence suggests that the carnivore diet might actually improve intestinal barrier function, reducing the passage of inflammatory substances from the gut into the bloodstream. Let me bring this down to earth. You might have heard of leaky gut. Leaky gut refers to increased intestinal permeability. So we want those pores, those holes to decrease. We want permeability to go down in order to separate all the bad stuff in your poop from the good stuff in your bloodstream. And in some cases, we do see that carnivore diet actually improves this despite conventional theories. However, this area really requires further research because we have research showing pros and others showing cons. The outcomes are super mixed in the studies out there on the results of carnivore diet on gut permeability. So this anti-inflammatory effect underscores the complexity of our physiology and the need for more research into the effects of the carnivore diet on our immune system. Let's go back to our timeline. Say you continue the carnivore diet into months 2 and 3. Remember the hybrid car. We discussed switching the fuel systems, glucose to ketones, but the changes that occur in the following months are more akin to upgrading the entire operating system of the car, impacting multiple interconnected systems. So this is where the hormonal effects of the carnivore diet become particularly evident. So let's consider perimenopause as a case example. This is a life stage characterized by significant hormone fluctuations. Many of my patients experiencing perimenopause report symptoms like debilitating PMS, unpredictable mood swings, and energy crashes that significantly impact their quality of life. Interestingly, some folks on the carnivore diet experience what I call the hormone reset phenomenon. So after a couple months, we often observe a significant decrease in fasting insulin levels, which is expected due to the keto nature of the carnivore diet, a normalization of cortisol levels, the stress hormones, especially if the person had previously elevated cortisol levels due to chronic stress or inflammation. And we also see some interesting changes with thyroid hormone levels. These changes are consistent with findings from studies on low carbohydrate diets. I just want to say that because you don't necessarily need to be on a carnivore diet to see the effects of a keto diet. There's a difference. For example, research has shown that very low carbohydrate diets can lead to a 50% or greater reduction in fasting insulin levels within weeks. It's crucial to understand that all these hormone changes are connected. Your body is like a finely tuned orchestra, with each instrument influencing the others. When you switch to the carnivore diet, you're essentially rewriting the entire orchestral score, leading to a cascade of downstream effects. That's why it's so difficult to study changes from big restrictive diets diets like the carnivore diet. But to summarize, these hormone shifts are essentially these several pathways we discussed. Improved insulin sensitivity. Reduced carb intake leads to lower glucose level, requiring less insulin secretion from the pancreas. This improves your insulin sensitivity, meaning your body's cells are more responsive to insulin signal and you don't need to make as much. Then you have modulation of cortisol rhythms. Chronic inflammation, chronic stress causes cortisol dysregulation. So by potentially reducing your inflammation, the carnivore diet might help restore a more natural cortisol rhythm with higher levels in the morning to promote the alertness that you need to get up and going, and lower levels in the evening to facilitate sleep. Then we have altered thyroid function. The carnivore diet can impact thyroid hormone levels, particularly by reducing the conversion of the inactive thyroid hormone T4 to the active form T3. The exact mechanisms are still being investigated, but they may involve changes in liver function and reduced inflammation. I bring this up not because people want to decrease their T3. Oftentimes, people want to increase it. But I think it's important because a lot of people don't realize all the downstream effects from a highly restrictive diet. This explains why many people report more stable energy levels, improved mood, and better sleep once they've adapted to the carnivore diet. I also want to mention the sex hormone shift. When you've been on a carnivore diet or a similar carb-restricted diet for 2 to 3 months, you may see some changes with your sex hormones. And I want to emphasize that there's a lot of individual variability, so don't take this as a blueprint for what might happen if you try such a diet. So if you think of your sex hormones, estrogen, progesterone, and testosterone, as components of this sophisticated feedback system, similar to a smart home that automatically adjusts temperature, lighting, and security to various inputs, we see some interesting effects to changing one's diet. In women who try the carnivore diet, we might see more regular menstrual cycles, reduced PMS symptoms, improved mood stability, and more consistent energy levels throughout the month. In men, this pattern might include increased testosterone levels, although the magnitude of this increase will vary greatly. And we might have improved balance between testosterone and cortisol, enhanced recovery from exercise, and improvement with body composition, often with an increase in lean mass and decrease in fat mass, even without great changes in an exercise routine. Again, there's so many differences between individuals. So I see all kinds of outcomes, and this is an area that we really need to do long-term studies to have clearer answers. So here's what's crucial to understand. While these hormone changes can be profound, they're not universal. I've seen people experience dramatic improvements within weeks, while others need careful monitoring or to stop this change in their diet entirely. Here are some key factors that seem to predict success. Your previous metabolic health before starting such a diet change, your stress levels and your sleep quality, your exercise intensity and type, and certain genetic factors that we're just beginning to understand. So where does this leave us? We've journeyed from historical medical oddities to cutting-edge biochemistry, from patient anecdotes to emerging clinical data. We've seen how a diet seemingly at odds with conventional wisdom can, in some cases, produce results that defy easy explanation. Here's the bottom line. The carnivore diet is neither a miracle cure nor a guaranteed disaster. It's a powerful metabolic intervention that can yield profound benefits, particularly for individuals grappling with specific health challenges and who have failed other interventions. But, and this is crucial, it's not a one-size-fits-all solution. Its efficacy is highly individual, influenced by this complex interplay of genetics, prior metabolic health, lifestyle, and even mindset. As a physician, I'm intrigued, but I am super cautious. The data we have about the carnivore diet is preliminary, and the long-term effects are still largely unknown, with the potential risk, particularly for certain individuals, being very real and very serious. However, I do agree that dismissing this approach based on outdated nutritional paradigms would be a disservice to the patients who are genuinely finding relief. My goal isn't to convert you to or away from the carnivore diet. It's to equip you with a framework for understanding this complex, paradoxical dietary approach. It's to encourage critical thinking, nuanced discussion, and above all, personalized decision-making when it comes to your health. Because if there's one thing I've learned in my years of clinical practice, it's that when it comes to the human body, there is very few absolutes. But we're not done yet. We've laid the groundwork explored the theory, and peeked into the clinical realities. In the next episode, we're going to get practical and we'll dive into my risk stratification framework that I use in my clinic. And we'll talk about the specific medical conditions that might make someone a good or terrible candidate for this diet. We're talking numbers like 20% of people with autoimmune conditions experiencing dramatic improvement, with 5% experiencing significant adverse effects. I'll also talk about essential lab tests that you absolutely need before considering the carnivore diet and the key biomarkers that we'll monitor religiously. For example, even a seemingly healthy LDL cholesterol level under 100 milligrams per deciliter can still indicate a poor candidate for carnivore diet. And we'll also talk about the exit strategies for folks who need to stop such a restrictive diet. For instance, if you have a sustained elevation of inflammatory markers above 50% of baseline, we definitely want to reevaluate whether this is the right approach for you. We'll also be talking about how to tailor the carnivore approach based on individual factors. Genetic predispositions, like certain ApoE genotypes, which influence a massive proportion of cardiovascular outcomes, and metabolic flexibility scores, which can help us predict success rates. And for people who find this diet is not for them, we'll talk about alternative protocols that leverage a lot of the same principles, but with a broader range of foods. I'm a big fan of having a diverse set of nutrients for one's diet. Like we talked about today, a keto diet doesn't necessarily mean a carnivore diet. You can just have fewer carbs, and especially fewer refined carbs, and see a lot of the same benefits. So next time we're going to be moving more from the theory to the action and turning from a super restricted approach of the carnivore diet to something that you can apply to your everyday life.